her OB is clueless as to why these cells continue to change into precancerous and possibly cancerous cells. And they're the ones that recommended the IUD in the first place.
Why is a chiropractor talking about an IUD? Are you saying the IUD causes cervical cancer?
In the first place. So you have to understand that when you put a foreign object into the uterine wall, your immune system is going to react.
One, an IUD goes into the uterus, but not into the uterine wall. So one, that's wrong. Two, let's look at the study that was done in Denmark, released in 2021. The short version is when they took women compared to taking oral contraceptives, hormonal IUD, and the copper IUD, they noticed that between these three groups, there was no difference between which one was more likely to get cervical cancer or not. Ironically, for those that got the hormonal versus the copper IUD, compared to oral contraceptives, the risks of severe invasive cancer was actually lower compared to if you didn't have an IUD in the first place. So he's basing his recommendation on a handful of people as opposed to, let's say, a research study like this one that looked at over 200,000 women. And then he just spends the rest of the video trying to rationalize how IUDs cause cancer, and he is making all of this up. He's still yapping.
Now, after my conversation, she does want to get that IUD removed because she wants to have balanced hormones. She's 36 years old. She has not had a cycle in 5 years. Ladies, the endometrial tissue within that uterus is made to slough off every 28 to 30 days. And if that does not happen, it is going to lead to more problems. Birth control is not safe. Birth control has a lot of side effects. And this is a very good example of that.
And then he tells her, maybe you should get the IUD removed. And she listens. Birth control is healthcare. It is safe. You do not need a period every month. That is a myth. Talk to your OB. Don't get scammed. Take back your health.